24 by 7, each and every patient who's admitted in our old age home or Kasturi care for seniors is taken care by qualified sisters, doctors, ward boy, maushi.
Today we are talking about a place which is not an old age home, nor an end of life care. This hospital admits patients which are terminally ill and difficult to manage at home. It's not only managing, it's also very expensive to handle such patients. So we have invited a medico couple, Agarwal couple, who owns a hospital in Bhayander, Shree Kkasturi Medicare, and they admit such patients. They are with us today, Dr. Rakhi Agarwal, who is a general surgeon, and Dr. Rajiv Agarwal, who is a pediatric physician. Welcome to 10th edition of Arogyam Katta.
Thank you.
Tell me how did you get this idea of what exactly is the concept? Can you explain what exactly you are doing?
Yeah, basically Kasturi care for seniors. It is a old age home within the hospital premises. This idea came to me about 10 years back when terminal patients or patients with stroke or other illnesses, they could not take care of their relatives at home because of lack of infrastructure, manpower shortage and all. So a few of them requested can we keep him or her in the hospital on a monthly basis. So I spoke to my wife and it was a good idea. This is one way we could help our patients. And so that is the reason why we thought, and we started on 1st July on Doctor's Day in 2014. We completed 10 years.
Over 10 years.
Yeah, the hospital is inaugurated in August 2001, but this old age home within the hospital premises, it is one of its kind in the entire India because 24 by 7, each and every patient who's admitted in our old age home or Kasturi care for seniors is taken care by qualified sisters, doctors, ward boy, maushi. Whenever they need any emergency, they are admitted in the hospital again, and they get proper care and timely care. And the best part is 24 by 7. Their medicines are given on time. They are taken care. Everything is taken care of.
What kind of support do you give to the patients? I mean, it's good that you won't get 24 by 7 because I see in old age home they have no medical facility, and in the medical facility there are no recreational facilities. So probably it's a hybrid combo model, which is an excellent one. How do you give support to the families always, also to the patients?
Yeah, we try to support both of them. As far as families are concerned, we have a flexible timings for them to meet the relatives because many of them are working members, so they may not be free in the daytime. We have a fixed time, but it is flexible because if the relatives do not come, then they can connect with their relatives on video call, phone call. Many of them are staying abroad. So we have given them our hospital's mobile number. They can call, and after 10 minutes again they can call back. So we try to connect with them. Whenever, as far as patients are concerned, who are admitted in our old age home, our sisters, every shift there is a change in the staff. So they take care of the patients 24 by 7. They those who cannot eat food, they are served food. Patients with RT or police catheter time to time. Plus television is there available 24 by 7. We have an open area on the ground floor where they can come and sit. But unfortunately the problem is most of them are terminal ill. So most of them are bedridden. So they may not be able to, one good thing what we do, when we come to know that today is the birthday or anniversary, we try to celebrate along with all our staff, because the family members may not be available. So that gives them a feeling of bonding, and they are not treated as patients, they are treated as family members. Whenever we go and meet them, we wish them and we talk to them, not as a patient, we talk to them as a family member. So it is like an extended Kasturi family for us who are there with us.
Madam, what kind of medical conditions you treat?
Namaskar. See, this is a hospital, but then it's a second home for the needy. It's not for the normal people. So the conditions what we treat are the bedridden patients due to any cause, Alzheimer's disease where they cannot take care at home. Then there are patients with coma.
Okay.
Then there can be cancer patients of any variety. post-surgical or on a chemotherapy or a radiotherapy. Then there are muscular dystrophy patients, the patients with dementia. Then there are disability patients. Then we have all with paralysis, Parkinson's, psychiatric patients which can be managed because of in-house psychiatrist.
Uh-huh.
Then we have senile dementia. Then spinal cord injuries, trauma patients like post-surgical, terminally ill. So these are the kind of patients, and the patients whom we feel they require prolonged care, which are of the normal outcome of the patient. Even to them, because they need extended care and already the money has been exhausted, we do offer to treat them for a month or two so that psychologically and financially they can be well off.
In fact, just to add to that, we have a 10-bedded dialysis unit also in the hospital, So we offer these services to dialysis patients also, because most of them, they are working members, most of them are nuclear families, very selected. So they can keep their parents or relatives in the hospital. We take care of the dialysis part. And, we are also on panel for Ayushman Bharat and Mahatma Jyotiba Phule Yojana. So if they have the orange or yellow ration card, this dialysis is offered free of cost.
It's free of charge. Okay. Is pain management an issue in such patients? Because
yes, most of the patients what I described, they do have pain. So pain can be managed by the normal pharmacological ways like opioids or NSAIDs. Then there are transdermal patches that are there. Then there we have in-house physiotherapist. She can take care of the patients with the infrastructure like TENS, the machines like IFT, weight training, gait training. So pain is managed, and upon that pain also there are many other symptoms which the patient might have, like they must have vomiting, then any other problems they have bed sores. So our staff as a holistic, they take care of all the problems.
great. And what kind of cost we are talking about once when we admit a patient?
Yeah, so we have categorized it according to the class which they take. For general or economy, it starts at around 30,000 per month. This includes stay, food charges, 24/7 nursing, ward boy, Maushi, and our RMOs on duty. So this is included in that. And if they have to go for a physiotherapist, it's a monthly charges, a nominal, say around 4,500 to 5,000 rupees a month. The dietitian charge is included in this 30,000. This dietitian visits the patient daily. If you go for a double sharing, it's around 40,000. If for a single room, 50,000. For AC deluxe room, it's 60,000 rupees. And plus whatever extra you need, maybe a air bed or a water bed. Medicines are totally different. Any blood test needed, they are different. Physiotherapy, any other things. The best part is, we don't have any hidden cost. Like most of the old age home, they charge separate for a powder, for a toothpaste, for milk, for eggs. It's a pure vegetarian food, but only if a dietitian recommends, then we serve eggs, boiled eggs to the patients. Otherwise, so we don't charge anything extra for anything. Everything is given by us.
When someone is admitting a patient, I'm sure it must be a traumatic experience for the family, also to the patient. How do we emotionally handle such things?
Well, because we are doctors, we know what the patient has, and we practice since 2 decades. So first the medical condition is understood. Then we have a well-trained infrastructure of the staff. So it is not the only that the RMO will attend the doctor. We two, husband and wife, do take daily rounds of the patients.
Okay.
All the patients. Because they are in an environment which is fully equipped. So half of the tensions are gone, sir. The families, they are very well, they know it is not dumping that they have dumped their relatives. It is that they have placed them in our very safe hands.
Okay. So that
And upon that, we have a psychiatrist. Suppose there is a mental ill health or something that is taken care of. Then we have nurses in charge who is very well trained. So all these people will emotionally support the patient each and every time they are labile. And then we let the relatives, we have a communication system with the relatives also. So if there are any things patient don't want to stay back, then it's the relatives who also counsel them to stay back.
Stay back.
And we allow them to go out, no? if in case they want to go out, few of our patients wanted to go out, or there are few patients who connect with the internet also with the relatives.
I see. So there can be a
Yes, there can be
open communication.
open
channel.
communication, and then they can go for a party. Few of the patients, they say that Sunday we will go. We'll make arrangements for the same.
Oh, I see.
So
Okay.
this is how we balance their emotional and psychology.
You see, running a multi-speciality hospital where we are tackling all kinds of emergency, so we are well versed of educating the patients, and the relatives about the seriousness of the day. So whenever such patients who come to our old age home also, so because we have that knack, we are running it for almost 24 years, so that is the reason why we are able to explain to them all the details. And there are even a escalation matrix also in our system where first point of contact is a person. If he or she is not available, he or she is on leave, you can contact the other person, so that they can connect with the relatives. So that way, if both of them are not, our numbers are also with the relatives, So that is the way they connect with us, and on a periodic basis, they are able to speak to each other also, the patient and the relatives
So
also,
communication
through
channels are always-
through WhatsApp call or video call or
So communication channels are. What happens if I'm sure there might be deaths also for such patients? How do you handle the families, or it's taken as a part of life?
As far as death is concerned, see, ultimately all of us will die someday or other,
so
so we
everybody
need
has
to
to.
accept it. And to be very frank, in this 10 years experience, hardly very few people were there who really got emotional, because ultimately they knew the condition of their family members, they were suffering ultimately. The patient is also suffering and the family is also suffering, So we try to convince them that this person has got moksha now. That is the end of his suffering, and they realize he has got free of his all pains and suffering. So this is how sometimes they get emotional. So we try to help them in whatever way we can help. Sometimes they are placed at distant places. So as far as cremation and other things is concerned, we give one of our staff to assist them, and we get them done with the final last rites also, and whatever way we can help them. It's not key because they've expired, our contract with them or our commitment with them is over. So we try to help them in every possible.
In every possible way.
And that is the reason why, in spite of not doing any publicity or marketing, our patients' relatives send us new patients.
Get it. And your communication with patients' relatives is always on.
Yeah.
And they have a full access to contact you or anyone of if they are not.
Being a hospital, we have a landline number working 24/7, which is operational in the daytime. The receptionist picks it up. In the night time, the doctors or the staff on duty take it. So, they can access to communication 24/7.
The patients are given single room, and what do you find that such patients should be in a single room or a multi-speciality room, or how should it be? Because that's single room is a prestige issue. Multi-sharing room probably is a convenience issue. Because
it all depends on two factors. First is availability of the relatives and the cost. Ultimately, whichever category of room you take, you have to bear the cost. So economy, we generally promote economy because the patient is not alone.
can be seen.
Patient is not alone. There are other patients, and the nurse continuously visits the general ward, because some other patient is there. So they also have company, and our general ward is also having a toilet, bathroom attached. There is a television inside the room, so it's not an issue. As far as private rooms are concerned, we have option of double sharing room, single room, AC and deluxe also. It all depends. Specifically, if there is some psychiatric pain, we do not take violent patients, because they could cause damage to or harm to other patients also. But relatively milder types of psychiatric patients who are just speaking or something of this verbal. But then we request them, if they are causing nuisance and disturbance to other patients, then we request them to go for a double sharing or single. Otherwise, for all other practical purpose, it is a choice of the patient and the relatives to choose what they want.
I'm sure you must be serving food. You are serving a food. Do you really administer the quality of food?
Yes, sir.
Because as a house lady,
Yes,
I
sir.
think.
We have an in-house dietitian, and we have contract with the food.
Okay.
So whatever the menu is made is for a week. So it is totally administered by the dietitian. And it is that whenever there are festivals or there's a birthday of the patient or Sunday or Diwali, it is not that these are not the patients, So we treat them as a family members.
Okay.
So they have to have something extra.
Something.
And on demand, as sir told, if they want egg, it's the nutritional requirement to get the egg. Or if the patients are with the PEG or with the JT feed. So whatever the nutrition value is, that is calculated and then holistically that is delivered
That
also.
is given.
Given also. And it is there that the Maushi and Warbai, they stand by the patient and they feed them with a spoon or with a hand, whatever they are comfortable.
I see.
It is not that they will not be serving the food. It is not only placing the food in their plate, So
It's feeding.
it's feeding them with love and affection that matters.
I see. How do you train them?
No, in fact, to add to what
big number of staff. That's all you
to add to what Madam told, this same food is served to our regular patients also, be it any class. It's a standard food, given to even a general ward or a super deluxe room patients or ICU patient, depending upon the dietitian recommendation, of course. The best part is, every day in lunch or dinner, we have 2 vegetables.
Okay.
It's not just one, So one will be a dry vegetable, one will be a wet, plus dal, rice, chapati, the salad, curds, and once or twice in a week it's a sweet also. And the menu is totally different for all 7 days. It's not ki maybe dal is repetition. Sometimes there is a dal, sometimes there is a curry, or but that is repetition. Otherwise, most of the vegetables, they are not repeated.
Seasonal.
Breakfast 7, one will be a seasonal vegetable, and 7 days different. And as far as staff training is concerned, since they are working with us for quite a while, we have very good old staff also in the hospital, and that is the reason why our staff trains the newcomers. And they also realize that these are not patients, these are like a family members because they are there. So a bonding develops between the staff and the patient also who's admitted in the old age home, and that is the reason why this. And sometimes some patients, they feel that today they want to have hotel food. So they can just inform us. We order food for them. Of course, they have to pay the charges for that. But that food is also, if they want a juice, if they want something outside also, we order. They don't have to do anything. We order. We take some money from the relatives in advance, say 500 or 1,000 rupees as an advance, which is deducted. We preserve the bills, and on a monthly settlement, we tell them.
And the relatives are allowed to keep the required food with the patient if they want.
I see.
It is not that we are barring any outside food. What the relatives with love they want to keep.
Okay, so
that is
if somebody is
an
visiting, he can bring a lunch and a bar.
Yes, absolutely.
And so many of other people, many times, many people, they come as a philanthropy, कि आपके old home के लिए हमें ये करना है. So it is not that we say no. Though we can afford and patients are paying for it, but then the feelings matter. So they are also.
In fact, the daily with breakfast tea is served for diabetic patients, sugar free or non-sugar with this. Evening again tea biscuits are served. Then there is lunch, there is dinner, and if needed, if there is a dietetic requirement, even milk is served at night to the patients, So that way, we take care, and it's a good food. It will be non-spicy, less of salt, and less of oil and ghee in that. But it is, when a patient paying 5,000 or 6,000 rupees for a deluxe room is eating that happily, and even small kids also who are, pediatric age, how they don't like food, even they eat that food well. Of course, they may need to add some salt or something for their taste, but as a hospital, we have this less salt, less spice, and less of oil and this.
I'm sure you must be facing a lot of medical emergencies. How do you handle such emergencies?
See, ours is a NABH accredited hospital, and we have ICCU backup 24/7, X-ray, sonography, color Doppler, EEG, PFT, 2D echo, everything, all the facilities. Pharmacy 24/7. Our pharmacy is for 12 hours, but we call it can be accessed, and emergency medicines are always available on all floors of the hospital. Maybe a ground floor, first floor, second floor. First floor we have an in-house dialysis unit. So whenever these old age people they get admitted, and if they have any problem, we immediately contact the relatives and we admit them in the hospital. So their journey in old age home stops at that moment, and the journey in the hospital starts. So instantly, whenever a person he gets fever, so our on-duty doctor checks it. If required, we do a blood test. and if it's some illness is picked up, we treat with medicines. If that is not treatable by medicines, patient requires admission. In that case, we inform the relatives and admit. And if they have Mediclaim, then Mediclaim facilities are available only for admitted patients, not for
old age home
patients, because that is not covered as per the insurance policies.
Okay. And madam, I'm sure with such patients, bed sores will be a common phenomenon.
So I'll say that.
And very painful for to manage and also to the patient. How do you deal with such?
So being a surgeon, I think the highest number of admissions are due to bed sores, or consequently because of medical conditions, the bed sores were there and they had to be treated. So because we have an OT, we have a qualified surgical staff. The first is we have to know why the bed sore is there. So changing the position of the bed sore, changing the position of the patient, then putting earbeds, and the main is hygiene part. The hygiene part the bed sheet has to be clean and has to be changed every day. If the bed sores requires twice a day dressing, it has to be there. So debridement is either just dressing or we have to do a surgical debridement. If that is required, and if I think that plastic surgeon is required, then we do plastic surgery if the patient consents. So we've treated a lot of, and we take care that bed sores don't happen. For the ongoing patient who is admitted, so in our care, there's a rare. If they have already developed and they are very superficial, then usually they get treated.
Okay.
And if the other things are that the patient is too happy and the conditions are very, very poor, like we had a patient of 130 kg, and it's impossible, too many medical conditions. In that case, then whatever minimum or maximum what we can do, we try to offer that.
She herself being a surgeon, and we have lots of diabetic foot and bed sore patients otherwise also. So our staff is well versed of handling them, so they get treated and cured also faster with her. And because our staff is aware, because we have ICU set up, so frequent changing of the position is a norm, NABH also asks her to do that. So that is the reason why the incidence of bed sore is very minimum in our hospital.
I see. So
otherwise also medication, nutrition, other parameters have also been taken. Because it's the holistic care which matters, and the experience is very important part of it. Yeah. That you know how to treat, then only you can treat.
Thank you for answering all the questions. I hope you make such many hospitals in future, because what you are touching upon is the really need of the hour. And let's see many hospitals, preferably of a couple like you, so that you can see the passionate and love towards the patients. So I wish you all the best, and thank you from bottom of heart for coming on.
Yeah, just to inform you, we have already purchased a plot for coming up with a 100-bedded old age home, which will be for both, for normal people also and for bedridden also. Soon the construction will start in 6 months to a year's time, and it should be operational by 2 or 3 years.
2 3 years. Great. All the best.
Thank you.
I'll ask you to rapid fire round questions, answers of which will be yes or no. So are you ready for it?
Yes.
Thank you. Doctor, do you provide care of bedridden patients?
Yes.
Can you handle terminal diseases?
Yes.
Are your visiting hours flexible?
Yes.
Do you have a palliative care team?
Yes, of course.
Is pain management a priority?
Sure, sir.
Is your staff trained for terminally ill patients?
Yes, sir.
Do you offer psychological support?
Yes.
Is there an emergency response system?
Yes.
Do you have an NABH certification?
Yes, sir.
Do you have an in-house pharmacy?
Yes.
Are care plans individualized or they're common for all?
No, they are, depending on the disease.
Thank you for answering the questions.
Thank you.
Dr. Rajiv Agarwal, it's your turn now. Is family involvement engaged in care plan?
Yes, also and no also, depending upon the condition of the patient.
Do you offer home visit assessment before you admit, if necessary?
If it is in nearby area in Mira Bhayander, we send our doctors for that, but not otherwise. They come with a history sheet and then we do it.
Are your meals customized for the patients?
Depending upon the dietary requirement by the dietitian, they are customized.
So they are not one for all.
Hey,
Portions
meals
will
are the
differ,
same,
the
portions will differ,
portions.
and sometimes, the patient is on a liquid diet, so then we have to give a liquid, so they'll get specific liquid diet.
Do you monitor patient satisfaction?
Yes.
Are there any recreational activities?
Television is there, then they can play on the mobile, we have internet facilities, then our staff takes care of them, we have birthday celebrations.
Do you assist in end of life planning?
Yes.
Are your facilities wheelchair enabled?
Yes.
Do you offer physiotherapy?
Yes, we have an in-house physiotherapist.
Can pets visit the patient?
No, we don't allow pets in the hospital because there are other patients also. The pet may get violent or something, we do not know.
Do you offer long-term treatment?
Yes.
Are bed sores common?
They are common before admission, not very common after admission.
Do you accept living wills?
Yes, if it is legal.
Do you offer experimental treatment?
No, we don't offer experiment unless the relatives insist that they want to try for some Ayurvedic or homeopathic. We take an undertaking from them, and whatever medication they give us, we give it to the patient.
Is smoking allowed for a smoker?
No.
Do you provide private room for all the patients?
No.
Are there unlimited visiting hours?
It is not unlimited but flexible.
Do you offer cosmetic procedures?
Yes.
Thank you for answering the.
I should also thank you, sir, for giving us an opportunity to share something about our organization, how we are able to help the society. And I look forward for interacting with you again. Thank you.
It was a joyous experience.
Thank you very much for coming.
Thank you. Thank you.
If you like the video, please subscribe to our YouTube channel, Arogyam Katta, where we bring you insightful interviews with doctors from various specialties. Stay tuned for expert advice and valuable health information.